So this conversation about Medicare for all is getting a little bit irritating and troublesome. I left it alone. I left it alone on Twitter because I felt I could just tell that people were uh, basically kind of being sycophantic about the whole situation. And at a certain point, it doesn't really help to engage people who are not actually willing to learn and listen. Um, but Mike Figueredo just couldn't let it go. Couldn't let it go. I don't know what it is. I guess his feelings were hurt because people did this thing when when you want to go find information. Uh, you start reading shit sometimes. I know it's crazy. It's not a common practice in America. It's definitely not a common practice in politics. But every now and then, when you want to know some information, you read some shit, and then you're like, "Oh man, I thought I understood, but maybe I didn't," which is okay. It's fine. But that's not what Mike did. Mike finally read the legislation and then decided he wanted to double down on being wrong, basically. And he tried to attack Tulsi in a very underhanded way. Take a look at this clip.
And this didn't get as much attention because most people who were so disgusted by the smears of Tulsi Gabbard as an Assad apologist were focused more on that. But something Tulsi Gabbard said in this interview that kind of blew up afterwards, it actually did give progressives pause, progressives such as myself, because she said something about private insurance that was a little bit worrying to me. And I almost hesitate to bring this up because I don't want to pile on. Like, it's frustrating. I get why there are so many people who are hypersensitive to any and all criticisms of Tulsi Gabbard. It's because she is oftentimes the target of bad faith smears. However, with that being said, there's so many people who support Tulsi Gabbard who watch this show that I still feel as if, if there's an area of opportunity, I have to bring it up. I have to address it. And, people need to be able to decide for themselves whether or not there's room for growth. And I absolutely think that what Tulsi says in this interview, which I didn't see until it kind of blew up online, it really gave me pause, and I didn't like what she had to say. So we're going to watch it, and then I'll let you decide for yourself, but then I'm going to tell you why I absolutely take issue with what Tulsi Gabbard said here.
In terms of healthcare, where are you on the spectrum of,
We've been hearing a lot about that.
Yes, Medicare for all,
Yeah.
or improve Obamacare.
Yeah.
Where are you?
Well, first, let me just say our objective has to and must be making sure that no person, no American who is sick in this country should go without care because they can't afford it. That's why I have been and continue to be a supporter for Medicare for all that would guarantee that healthcare, that quality healthcare for every single American in this country. I also believe, like every other developed country in the world that has universal healthcare, that there is a role for private insurance to play for those who want it.
Do you think for those who are embracing taking away private insurance from people, ultimately, is that just strategically, politically, a non-starter?
I don't know about the politics of it. I just think about it from the perspective of people, of the American people, that if all of a sudden you are taking away their choice, that's not a very American thing, in my opinion. I think our responsibility as leaders is to meet the challenge and address the problems that people are facing, that they are suffering because of big insurance and big pharma's influence over our healthcare system for so long, how they are profiting on the backs of sick people. So let's do our job, try to bring down the cost of healthcare in this country that's exorbitant, make sure people can get the quality care they need, and if they still choose that that's not what they want, they can go get the private insurance.
Okay, so let me be clear. In no way do I think that was anywhere near as bad as Warren's "there are many paths to Medicare for all" line, but it still was deeply, deeply disappointing. Because Tulsi Gabbard was one of two candidates who I really felt like they hadn't wavered on Medicare for all. And I don't know that she's wavering here. I think that really we need more clarification. But what she said there absolutely worried me, because I want someone who's going to get in there and just crack skulls and make these private insurance companies deathly afraid. But that's not what we got there. So we'll talk about the good thing. First, she affirmed support for Medicare for all. But then she says, I also believe, like every other developed country in the world that has universal healthcare, that there is a role for private insurance to play for those who want it. Now, that's true. There is private insurance in other countries. So, for example, the UK, they have a national health system, right? That means publicly ran hospitals. But still, there's about a 10% private market in the UK. So that's true. But the difference is that when you're going into negotiations and you have a strong Medicare for all bill that leaves no room for any private insurance, you don't want to vocalize this. Like, you don't want to broadcast to the health insurance industry that there's going to be some kind of a role for them, because if you give them an inch, they're going to take a mile.
Yeah. So basically, he tried to spend the first 3 minutes of the video kissing Tulsi's ass in a very disingenuous way. He already covered the topic on Kamala. I don't know why he's pretending like he did. Like, he already did all that. What does that have to do with what we're talking about right now? Oh,
Yeah,
that's
that
right.
was my reaction. I was
No, go ahead. Yeah, no, it's basically, you could tell he has been hearing the criticisms of how ridiculously, like, he has a clear double standard for Tulsi and Bernie, right? It's one thing to support one over the other. My standard for Tulsi and Bernie basically are the same, which is where my endorsement originally came from. But that's not where this is happening with Mike right now. He is basing his logic off of the conclusion that if Bernie says it, it must be right. And that's just simply not true. Bernie said that he doesn't want healthcare at all, right? Or excuse me, private insurance at all. He said that. It wasn't true. It's in his bill, right? He said that Russia stole the election and gave it to Trump. He was wrong about that too. He called Maduro a brutal dictator. He was wrong about that. People can be wrong. Tulsi called Assad a dictator once, and I roasted her for that. She should not have done that.
brutal dictator. Right.
Yeah, she called him a brutal dictator. Wasn't fair to him. Was not based on evidence. Said the same thing about Maduro once. Learn from it, but she shouldn't have said it to begin with. And so I agree that it's important to call out actual concerns. But I'm not going to stand by and just let him invent concerns. So, first, we're going to address this myth once again, the 50,000th time. Mike keeps talking about the fact that there's no room for private insurance in Bernie's bill. There's no room for it. No room, no room, no room. Okay, so Section 107 of Bernie's goddamn bill for the last time, because people clearly want to ignore the facts. The prohibition of duplicate coverage. In general, beginning on the effective date described in Section 106, it shall be unlawful for private health insurance to sell insurance coverage that duplicates the benefits provided under this act. That's true. And that's the part that generally people latch on to, except for there is a whole different section of that. You know, that was part A. This is part B that we should probably listen to. Oh, nothing in this act shall be construed as prohibiting the sale of health insurance coverage for any individual or additional benefit. Additional. You hear that? Additional benefits, people. And specifically benefits that are not covered by this act, including additional benefits that an employer may provide to its employees or their dependents, or to former employees or their dependents. That seems like a lot of room for private insurance. So what would be covered under Bernie's bill? So under Bernie's bill, well, let me pull that back up. Under Bernie's bill, here are all the things covered. The general scope of the things covered, I should say, because it doesn't go into very specific things. Hospital services, including 24-hour emergency care, ambulatory patient services, primary preventative services, prescription drug services, mental health and substance abuse services, laboratory and diagnostic services, comprehensive and reproductive and maternity and newborn care, pediatrics, oral health and audiology and vision, and short-term rehabilitative emergency services, necessary transportation care. That's pretty comprehensive, right? Yeah, it's decently comprehensive, but it's like the literal definition of basic coverage. I'm gonna talk about some things really quick that Bernie's bill does not cover. It does not cover. It covers dentistry. It does not cover orthodontics. It covers optometry. It does not cover ophthalmology. Bernie's bill, for those of you who don't know, leaves it up to the state when it comes to long-term care. So basically, and, and this is going to be the interesting part, but basically the legislation that Tulsi actually co-sponsored, Jayapal's legislation, does not leave it up to the state. It lets the federal government pay for that so that they're not restricted on resources, because my coverage in New York might be great in the state, but my coverage in Alabama, they might say, nah, get on with your crazy stuff. It does not cover chiropractic. It does not say how many visits you get to the hospital. What it says is, oh, the doctor shall determine what is medically necessary for you per month. But what if you need to go anyway? And the doctors are overwhelmed. You forget we have a problem with doctors now, with a shortage and too many patients. So now we have a shortage, too many patients now, and now we're giving everybody an opportunity to get seen. What do you think is going to happen whenever the doctor is trying to figure out who should and should not get, X amount of care? They're going to base it off of the billable time they have available, not necessarily your needs. However, if you have supplemental coverage and are willing to pay a little bit more, then your needs may be considered a little bit more. That's just how supplemental coverage works. I know this because I worked in a supplemental insurance company. That's literally what I did. That is what, that's what Bernie's bill does. It includes private care. It has more room for it actually than the bill Tulsi signed. Which Sophia, take over before I.
I mean, I was just going to add that the whole issue is that it doesn't specifically lay out what the actual benefits are, so that we know what the possibilities of the additional benefits would be. So that's why it's easy for Bernie to be able to say, oh, well, it's, cosmetics only. If you want to get, if you want to fix your nose, if you want to, do this, do that, that is considered supplemental, only cosmetics. But that's that's a generalization of all the possibilities, because you can't just be expected to be covered if I'm like, okay, I want to go to the doctor every week because I feel like I might be sick or something. That you can't do that, because the doctor needs to prioritize based on need. So that's what a lot of other developed countries do. They allow for the supplemental insurance so that it can mean shorter waiting times for non-essential procedures or appointments. And that's the entire benefit of it too, because it keeps the cost lower for the
Yep.
Medicare, for the single payer government
Like
insurance.
maybe you went to the doctor once that month already to pick up your prescriptions and to get a checkup, but then you get the flu the next week. You don't know if the doctor is going to cover that. And you don't know if the doctor is going to schedule you a follow-up, and you might need one because you've already been 2-3 times. And oh, by the way, under Tulsi and Jayapal and Ro Khanna's bill, actually you would have a higher likelihood of being covered because it would be the pay would be paid out by the federal government. However, under Bernie's bill, not necessarily the case, because it would be decided by the state. So
yeah, and this is
go ahead.
yeah, I was just gonna say that's probably why people like Gillibrand were able to co-sponsor it, because it has to be a little bit weaker for them to get on board. It has to,
She
they have
bragged
to be
about it. She
yeah,
was an intricate piece in getting that legislation put together. And I think it's interesting because in this video, basically, Mike is attacking Tulsi. Like I said, and it's not a real attack. It's one of those passive aggressive, but come on, like we're all adults here, okay? Like let's not play stupid. We know what he was trying to do. This is he's been fighting over this on Twitter for 3 days. And he's trying to suggest that Tulsi is weak on what Medicare for all, even though Tulsi was the only one who called out the fact that all the other people on stage were equivocating, and that she said there should be absolutely no equivocation on Medicare for all. She is the one who exposed the fact that Sibelius was the one who actually wrote Obamacare, and how problematic it was that she wrote Obamacare, and then she also helped to write Kamala's bill and how problematic that is. Like, she's the only one other than Bernie who has been unequivocally for Medicare for all. The only thing she did was admit that there is private insurance involved. I mean, the only thing she could have did better was say supplemental, and that's about it.
yeah.
That's the only thing she could have.
I had the transcript of that interview that she did with Anderson Cooper, and when I was reading it again, it was clear that he was framing the question as getting rid of the choice to have private insurance. It wasn't saying getting rid of your current private insurance. It was saying the choice to be able to get additional private coverage. So
Yeah,
she was saying it would be un-American to get rid of that choice to get supplemental. She wasn't
yeah,
saying that it's un-American to take their healthcare away, because she understands that everyone under a Medicare for All system would be covered with basic coverage, comprehensive coverage. But
hmm
you need to have some kind of role that the private insurance companies are going to play, or else the cost of the Medicare system is going to go up, because everyone's going to need to be covered for everything. So you need to have
exactly.
certain restrictions in place. And this is why one of
There's a
the
whole
right
section that
wing,
says limitations. There's literally a whole section in
right,
Bernie's bill that says limitations and restrictions. So like it's going to be there. And the truth of the matter is there is like so Mike talks about operating from a negotiating standpoint, right? Because once again, I want to frame this correctly. This isn't really about Bernie. It's really not even about Tulsi. It's about people just willingly ignoring facts because it it doesn't suit their narrative at the time, right? And it's sad because the projection from Mike is that, oh, Tulsi supporters are cultists for educating him on the verifiable it's right here. It's a tangible fact. This does not eliminate healthcare or private healthcare. It doesn't. And he starts talking about, oh, while we want somebody who's going to crack skulls in the negotiating process for Medicare for all when they get into the White House. Mike, that's not a good argument to make for Bernie. It's not, because he did negotiate already. He said we don't want to pre-negotiate. That's what he said in the video. He negotiated already, and his bill ended up becoming more watered down than the bill that Tulsi co-sponsored. In other words, Jayapal's bill, 2-year transition period. Bernie's bill, endorsed by Kirsten Gillibrand. So that's good news, right? Yeah, I'm sure. Uh, 4 years. Jayapal's bill mostly deals with handling the payments through the federal government.
mm-hmm.
Bernie's bill, especially when it comes to major issues, like for example, Jayapal's bill when it talks about long-term care, which is a huge deal. It talks about dealing with it through what? Medicaid. Medicaid has to go through the state. Whereas that's Bernie's bill. Jayapal's
Mm-hmm.
bill deals with it once again for long-term services through the federal government. So like that is already so Jayapal's bill leaves less room. So the bill that Tulsi co-sponsored actually leaves less room for private insurance than Bernie's bill. And we're going to talk about negotiating. So why was there an heir apparent bill right there that was introduced first? That Jayapal co-sponsored, Ro Khanna, Tulsi Gabbard, and plenty of other progressives. So why
Right,
was that
that was
introduced
more.
first? And then Bernie's bill was introduced, and it was actually worse than Jayapal's bill. It's like they literally took what made Jayapal's bill so great and watered it down in the negotiating process.
Right,
Mike,
right.
you're aware of this because that's just the tip of the iceberg. Bernie's bill is not the best bill, like when it comes to what we have available for Medicare for all right now. Jayapal's is, and that's the one that Tulsi's on. If you don't remember, so where are you? What is this? What are you talking about? It just virtually eliminates it. No, it doesn't. There's nothing. You're basing that conclusion, and I don't think that he even meant to do it. I really don't think he meant to. But when Bernie said he wants to eliminate private health care, too many people took that too literally, because he's not doing it. And they're like, well, Tulsi needs to clarify her stance. I got some bad news for you. No, it's not Tulsi needs to clarify. Tulsi said what the bill says.
Mm-hmm.
Bernie said the complete opposite.
And also regarding the negotiations, if you really wanted to be a good negotiator, your plan that you would have introduced would have been like an NHS style system where it's totally publicly funded. You know, there's no private hospitals or anything, and then you negotiate down to the current Medicare for all. You know, either the Jayapal one, which is more progressive, or you go to Bernie's and Gillibrand's and the others.
By his logic,
So
that's what it should have been.
Yeah, because that would have been a strong negotiation. But obviously, the Democrats probably wouldn't have agreed on that because some of them are still going to get donations from private health insurance companies, which still have a role in the Medicare for All bill. Again, that's why someone like Gillibrand would support the Medicare for All bill.
Exactly. That's like, and I couldn't put it better myself. Like, you can't make the argument we should, we have to start high. We can't start negotiating with private health
This
insurance.
isn't, yeah,
And
this
it's like,
isn't the
hold on,
best.
what do you mean? Huh?
We should be negotiating down to a Canadian system, not, we
And
should be starting at like the British, the British
well, no, the
healthcare
British
system.
system they have supplemental health insurance too.
They do, but I'm saying like mostly 99%, let's say, publicly
Yeah.
funded, and then negotiate it down to something that
Eh,
suits the private sector and the public sector, rather than just,
exactly. Like, especially if you're gonna make that argument, like, because he makes the argument as if that's what Bernie did. That's what's pissing me
mhm.
off. Like, Tulsi should have did this instead. Why you keep pointing your fingers at Tulsi? She's not the front runner right now. So like, if shit goes downhill, it's not gonna be Tulsi at the end of the day, as far as it looks like right now, that all the backlash comes on. But the fact that you won't acknowledge it now bothers me because eventually you won't acknowledge it later. Like, you'll tip tap around it, but like, you might even do a tweet or so, but it won't be detrimental to you. You won't acknowledge the pattern that we've been seeing. Because if you're gonna say, we don't know, I just want to know if Tulsi's gonna have the conviction to fight for it. Did she fight for Assange? Oh yeah, okay. Did she fight for Manning? Okay. When everybody was throwing Bernie Sanders under the bus in 2016, did she fight for him? Okay. Did she sacrifice her career? Yeah, right now she's the only one in the race who literally sacrificed her career or almost killed her career to endorse Bernie. Okay. When everyone on that stage was talking about their little bullshit Medicare for all, who got it right and said that we need to be unequivocally for the Medicare for all? That was Tulsi. She fought she corrected herself and she showed conviction in her consistency with meeting with whoever and
Mhm.
wherever
Mhm.
to
Mhm.
to promote peace. She showed consistency. She corrected herself with this. Even, I mean, not corrected herself. She went even deeper to the Assad stuff once she got the OPCW leaks in one of her recent interviews, saying that now that whole thing is in doubt. The only
Mhm.
candidate willing to do so instead of towing the establishment line. So you decide to pick one weirdly framed interview to do a 20-minute video on how I'm worried she's waffling because she's not negotiating from the right place. She's negotiating from the place that Bernie clearly started to negotiate
Yeah,
from.
and when he had tweeted, or it was Lauren, right, who was tweeting about how the National Nurses United said that there was that basically
Yeah, they're
Tulsi
wrong.
was wrong in her answer, right?
Yeah, they're wrong.
And then someone had commented about, because Mike had commented on it, said thank you
Yeah.
and stuff. And then I had pointed out, because he was saying you care about personality, not policy. He was responding to someone else. So I had pointed out, you are kind of doing that when you're taking Bernie's word for
Now, hold on,
what
real
the
quick,
role
real
of the
quick.
private health
So to clarify,
insurance.
I want to let you read that again. I want to clarify. When she said Mike said he cared about personality over policy, he still thought that this was about Tulsi. I want to keep this because at this point we're just arguing over the private versus like the phasing out versus the not phasing out, private option versus public option, whatever, whatever. He brings in Tulsi to the discussion. So I just want to clarify that. Read that again, please.
Yeah, so he was just saying, someone was suggesting, you're kind of becoming like a TYT journos, that Tulsi doesn't really support Medicare for all. He said, I never said that, only stated concerns with her rhetoric. But this convo is useless because you and the rest I've muted, right? So he started muting people who were arguing with him, not really arguing, but pointing out why he was wrong, have made it clear you're going to scold us over any and all critiques, even if they're in good faith, from allies. You care about personality, not policy. So I pointed out that he was kind of putting personality over policy when he's not looking at the actual Medicare for All bill. He's taking Bernie's word for the role of it, how Bernie personally doesn't want private health insurance companies to be in existence. That's not what the Medicare for All bill is doing. And then he's like, oh, says the person with Tulsi in their biopic, no, I was wrong like you before too until I educated myself. I don't worship Bernie. He's wrong on BDS, silent on Assange, bad on Venezuela, and abysmal on reparations, policy over personality, do better. And it was just weird that he brought that up because that wasn't the point. I'm not talking about Tulsi versus Bernie. I was specifically pointing out that there are a lot of things that Medicare for all is not going to be able to cover if you want to be able to keep the costs down and not bankrupt the system.
Exactly. The costs are like such a big thing. Yeah.
Yeah, and he was just overreacting. I was just pointing this out in good faith, and then he was like, I wouldn't have brought it up if he didn't accuse me of putting personality over politics first. Stop reading my shit if you're so triggered by even the mildest criticism. Educate yourself for fuck's sake and grow the fuck up. It was just
That's what he said to you?
Yeah, that's what he said to me. Yeah, it was just done in very bad faith. Again, I wasn't saying, Mike, you're trash, you suck. No, I was just saying, Mike, I think you're taking Bernie's word for it rather than actually looking at
because
the
where else would you operate? Where did you get that from? Right? Where is this idea that there's no private health insurance? Where did it come from? It came from that one fucking interview with Bernie. And instead of people it's not Bernie's fault. Bernie is a politician. Bernie needs to get his stuff together as far as that's concerned, but it ain't Bernie's fault. It's everybody else's fault who just accepts people's word for it and doesn't do their own research. It's not Bernie's responsibility to do your research.
Later, he was saying, I'm not taking Bernie's word. I don't like it when he says private insurance can exist for plastic surgery because that doesn't make sense. That doesn't even make sense. But I don't have to prove myself. I'll continue to say what I want, and people can accept it or cry and scold me. Doesn't matter. So it sounds more like he personally does not want there to be a role of private health insurance companies. That's not the point.
Fine.
The point is the bill. That's fine. He can have his own opinion. He has his article that he continues to link to from The Nation. The point is what the actual bill is stating. That's what we're arguing. I don't care if he thinks there should or shouldn't be a role of private health insurance. I don't care if I think that. The point is that's what the bill says. That's what Tulsi was talking about. That's what Bernie is talking about. And they both have differing views. Tulsi agrees with Ro Khanna, right?
Tulsi and Ro Khanna are on the same page.
Everyone is covered. And if you're not happy with it, if you want more, this is literally what Ro Khanna said in his own words. He said, then you can keep the private health insurance. You can get the private health insurance to cover additional benefits.
That's what's called supplemental.
Which is exactly what the bill. Yeah, which is exactly
called
what
supplemental. And so what it comes down to, in my humble opinion, and I can't speak for everybody. I can't speak for Mike because I've been following this conversation long enough to know exactly what's going on. Mike tried to lash out at Tulsi. He was wrong. He tried to pile on. In this video, in the beginning of it, I don't want to pile on. I don't want to pile on. No, he meant to pile on. That's exactly what he meant. So that's a lie. And he was wrong fundamentally.
Talked about Kamala and stuff before.
Yeah, it was weird. It still was weird how he included nothing at all. But he was trying to pile on. And when he was exposed that he actually had no idea what the bill actually said, because his first video addressing this didn't even talk about the legislation. It talked about how bad private insurance is, which is a whole separate debate, and we can have it because I would generally agree with him. When private insurance is in control of every aspect of the medical industry, then of course it's horrible. But that's not the discussion we were having. And he tries to frame it as a bad private insurance bad. Tulsi likes private insurance, therefore Tulsi might be bad. No, the conversation, Mike, if he wants to have a debate about the role private insurance should play, and if it's just holistically bad to have it in there at all, he can't have that conversation. Because basically what you're saying is, if Mike's side of the argument is right, then Bernie is wrong. And he will refuse to engage in that discussion. Because I don't think that Bernie or Tulsi or Job Power are wrong here. I think that they should have went further in Bernie's bill as far as not allowing the state, because when you let those states take over, it's never good. It's never good.
At least you can run a deficit with the federal government, but you can't run a deficit on state.
But other than that, I think that it's a good balance. I don't think that it's because it does not allow for duplicative coverage, which means the very basic things that you get with their bills, like somebody can't tantalize you with that, right? And that's what that means. That doesn't. I said there are a lot of things that aren't covered. I described a few of them in the beginning of the video. However, for Mike to say private insurance is bad, for him to acknowledge, he said it, not me. I mean, private insurance is bad, like I just said. But I'm saying from his words, private insurance should be completely and totally wiped out by his words. Okay,
Gonna phase
then
it
the
out.
next logical step is bills that have private insurance should be completely and totally wiped out. So the next logical step would be, unfortunately, if you're going to call Tulsi wrong for that, you have to call Bernie wrong for that, and that's what he won't do, regardless of whether or not Bernie is right or wrong.
Yeah,
And
and
this is the man who won't critique, and it's a fundamental like pillar of Bernie's entire message. And so Mike is working backwards from his conclusion, from the conclusion that where else would you have gotten the idea that there will be no private health insurance?
right.
You didn't read it in the bill.
Right.
So where'd you get it from?
Yeah,
Go ahead.
and someone had pointed out to him, hey, Tulsi actually, because Mike's whole argument was like, oh, it sounds like she's for a public option, which is not true. She's for a private option, which is exactly what Medicare for All is. So someone linked to him a video. I believe this was a town hall in Milwaukee. I'm not 100% sure.
Was it New
But
Hampshire?
it was a couple of weeks ago when
so
she
it might have
came
been.
out. Yeah, she came out against the public option because she was saying, listen, I don't think this is the right framing. The framing is that everyone is going to be covered through universal health care, and if they'd like to get the private option, they can do so. I think she does need to specify that it's supplemental, that it's not, oh, you can, because she said you can buy into private health insurance, right? But the whole
That would
point
be
that
the
she's
word
saying,
for it, but people don't know it because
right,
they're not in the private health insurance industry.
right,
So like
right.
that's like, and that's
So,
why Bernie said what he said, because he's not in the private health
right,
insurance industry either. Neither is
yeah,
Tulsi, so they don't know
yeah,
how to frame it
yeah,
correctly. It's not their fault,
right,
but
yeah.
we also have the bills in front of us.
Mhm.
So like we can extrapolate, Sophia's favorite word. We can extrapolate from the bills that they're going to cover what they cover. They're not going to cover everything, but private health
And we
insurance
can,
will have a
and people can disagree if they like how the Medicare for All bill, if they think it's too weak, if they think, you know,
but they don't.
that's
Nobody wants to say that. That's where the
mhm,
problem is. Like, because if some people like, I like Jayapal's bill way better than I like Bernie's bill. I do, and nobody wants to say, "Shit, is Bernie's bill weak?" Because it's a can of worms.
mhm.
But don't ever, you want to question somebody, don't question Tulsi. If she has a
Yeah, and
conviction,
actually, who
something
you
through.
should question is Rokana, who co-sponsored Medicare for America on
Oh
May
yeah, that's a
9th,
whole
I
different
think it
thing.
was. Yeah.
Yeah,
So
that's a whole.
that is something that should be more concerning, because it would be concerning if Tulsi had
Co-sponsor something
co-sponsored
else.
it, because then maybe you would be a little bit more justified in your worry where she's framing it as if it's a public option, which is not what it is. But anyways, you could be a little bit more concerned if she did so. But it is concerning. I don't understand what Rokana's intentions are in co-sponsoring such a legislation when he's also specifically talking about how amazing Medicare for All is.
Especially because in May, Medicare for America was
Yeah, it
created,
was
and
May 1st that it was introduced, and he
Jayapal's
signed
bill is
on
in
to it within
February.
8 days. Yeah.
Jayapal's bill is in February, which means there's already a viable Medicare for all plan in Rokana.
Mm-hmm.
Once again,
Waffle.
so like,
He's the one who's truly waffling.
where is I'm confused. Where is Tulsi wavering? That's the fucking
Right.
problem with Tulsi. That's why people hate
And
her.
the other thing,
She refuses.
too, is that Rokana and Bernie need to get on the same page, because Rokana frames it correctly that everyone's going to be covered, basic coverage, right, comprehensive. But if they'd like to, if they're not happy with what's covered, if they'd like more, they can be free to get their additional supplemental private health insurance. That's
Exactly.
an option that's
So
provided
like,
with Medicare
if
for All.
so basically, if Tulsi's on the same page, Rokana's on the same page, and, Jayapal and everybody else are on the same page, Bernie's saying something different. How is it Tulsi's fault that everybody's on the same page but Bernie, who you got your original premise from?
Mm-hmm.
No. And if you like, I knew what was meant by all of it, and a lot of people did. But if you want to ask somebody for clarification, don't ask Tulsi. It isn't Tulsi that needs to clarify. It's Bernie.
Right.
And
And
it's something
people need to be asking experts that actually work in the private health insurance company, in the private health insurance industry, so that they hear okay, what are the possibilities of things that you can cover? And again, this goes back to the issue, which is that it's not actually laid out what the restrictions are yet. So
Yeah,
we're
not
unaware of
in
that.
great detail.
Right.
Because
It,
people
it, it
forget, like after
vaguely.
this bill, the regulations have to be written. There's no
Mhm.
regulations yet, so we don't know. We don't, and that's a different debate to have. But like, you do not know what's really going to be covered. You don't. I'm
Yeah,
sorry.
you don't know. You don't
Everybody
know
thought
if
they
you
knew in
have.
ACA,
Mhm.
and the bill was better. Like it looked good. It looked good on paper. But after the bill's introduced and passed, the regulations have to be written, and that's when things become a problem. Period. And especially in Bernie's
Yeah.
bill, where the regulations are going to differ from state to state. Again,
And
Bernie's
it doesn't
bill looks closer to
specify.
the ACA than the bill that Jayapal put forth and that Tulsi
Mhm.
co-sponsored. If you
Yeah,
because
and I
that's
mean it
what the
doesn't.
fatal flaw was. The states had way too much control over the ACA. Go ahead.
Yeah, I was just gonna say, like, it doesn't say, okay, let's say 10 doctor's appointments are covered. It doesn't say that. You don't know that. Maybe it's just twice a year. You don't know that. And again, there has to be restrictions, or else what is stopping you from going and expecting that you'll be covered every single time you go? There needs to be restrictions, or else it's going to bankrupt the system. Unfortunately, that's how it's going to work. So, and that's how it works in other countries. That's why there's this right wing framing um, attacking Medicare for all, where it's like, oh, care is rationed. Yes, it's rationed based on need. Right now, it's based on how much money you have rather than need. So the
Mm-hmm.
hospitals will be dealing and will be prioritizing based on need. And that's exactly why the private health insurance companies then can prioritize, can get those people to be ahead if it's not essential for certain
Yeah,
procedures,
exactly.
for certain appointments and stuff. So that's how it's able to shorten waiting times. This is how they do it in other countries. Like
Yeah. This
it's
actually
not,
supplemental care does allow opportunity to have shorter wait times. It does.
yeah,
Because now the rich
exactly. And
people
that's,
aren't going to the same hospital to the same doctors necessarily as everybody else. They are able to pick. They have probably more
mhm,
freedom. Um,
mhm,
and they can, if it's a specialized surgeon in a different state that accepts their insurance, they don't have to wait.
mhm, mhm,
And that's fine. It
mhm.
decreases the wait time for everybody else.
Right, and again, we don't know what kind of like what specialty doctors are going to be available for you to go to or anything, and that's exactly what the
Exactly.
supplemental could be. So again, to reduce it to cosmetics is just not
It's silly.
accurate at all. And even Mike
So
apparently had a problem with that. I'm not exactly sure
no,
what his
yeah,
issue was,
because we
but I
finally
think
people had hammered him on like
yeah,
you can't keep trying to pretend like it's going to be just supplements, it's just going to be cosmetic. And then he finally
right.
came out like you know how long it took him to address the fact that it had private health. It took like 2 days arguing with
Mhm,
people because everybody else read it and it was clear that he didn't.
mhm.
He kept
And he
sharing that
specifically
BS.
actually mentioned the section. I think it was like 117A,
Yeah,
I
he
believe.
then he finally mentioned the section. He quoted it, but he
Mhm.
left the part out about that.
After people had sent it to him. I forgot how he said it.
Yeah, like it was weird. It was weird. So,
Yeah.
with that being said,
Yeah.
people, I hope that cleared the air on the entire Medicare for all situation. But it's disingenuous framing. He's trying to basically frame it that Tulsi would somehow waiver or waffle on healthcare because she's literally talking
Yeah.
about the bill that everyone is in agreement on except for Bernie,
And
even though
again,
Bernie's bill.
this isn't even about Tulsi versus Bernie. This is about the Medicare for All bill versus what Mike and other people want the Medicare for All bill
Yeah,
to
facts versus
yeah,
fiction. You're talking about
mhm,
real shit, or you're talking
to
about
restrict
rhymes.
and stuff.
And
Yeah.
sometimes, yeah, reality can be disappointing at times when you expected something that had such high standards, and
Mhm,
then because it's I understand it's a multi-layered issue. I get it.
mhm,
A lot of people thought that a lot of people, not a little bit, a whole lot of people thought that this bill completely wiped out health insurance. Then the goalpost moved from does it wipe? It went from wiping out health insurance to it leaves no room for it. That's
mhm.
not true. It's just simply not. It's not.
And I thought
So,
so too, because I took Bernie's word for it, and then you actually read the bill and you're like, yeah, no, that's not what it
hmm
does.
yeah,
And also looking at how other countries use supplemental insurance, it also makes sense. That's what we're trying to
exactly.
get at. We're trying to. So.
So yeah, I hope that cleared everything up. And you know where to find me if you need me. Peace.
Hey, don't forget to subscribe and hit the notification button to get all of our notifications if you like that episode of Mikasa Sukasa. You can also help continue to grow our show by donating to our Patreon and helping us hit our goal of 500 patrons. But remember, more than anything else, find your balance. Peace.